SC-ImpRes is a comprehensive resource. It offers guidance and opportunity to reflect how to design and to conduct implementation research in social care. It was developed by researchers from the NIHR Applied Research Collaboration South London, and the development was informed by the advisory group consisting of major social care and implementation research experts. SC-ImpRes is for social care researchers and practitioners who are doing or planning to do research about implementation of anything. It could be a program, an innovation, a practice, and so on. There are 8 sections that present key elements that are helpful for designing and performing implementation research in social care. For instance, implementation strategies or implementation outcomes. Also, there are questions to prompt reflection, how best to incorporate implementation research principles and methods. The sections can be used in sequence or separately and selectively. People working in social care are always looking for the ways to improve services. Implementation research facilitates the adoption of effective practices. It aims to improve quality and efficiency of services and care. Initially, implementation research emerged as a branch of healthcare research, but it is just as important in other fields as well, including social care.